Good evening, everyone. It is my distinct pleasure to introduce our speaker for today's session, Ms. Ruchi Babra. She is a passionate healthcare professional with a clear vision to digitize and improve healthcare systems through the power of technology. With a strong foundation in microbiology and an MBA in health IT, she excels at bridging the worlds of science and strategy, delivering meaningful change across the healthcare landscape. Over the past 3.5 years, Ms. Ruchi has led impactful projects that have not only advanced organizational goals but have also earned her recognition from esteemed clients such as the Bill and Melinda Gates Foundation and the Koita Foundation for Excellence in Delivery. Her outstanding performance has also been honored by Ernst and Young, reflecting her commitment to excellence and innovation. Ms. Babra's leadership abilities have been evident since her academic years and continue to drive her success as a healthcare technology consultant. Her unique blend of technical expertise and strategic insight positions her at the forefront of healthcare transformation, making her an inspiring voice for today's discussion. So please join me in welcoming Ms. Ruchi Babra.
Thank you so much for the introduction. Good evening, everyone. Just give me a moment, I'll just present my deck. Uh, Prati, are you able to see the screen?
Yes, ma'am. And are you also able
Okay,
to change the slides, ma'am?
yeah, just give me a minute. Is my slide changing?
Yes, ma'am.
Okay, great. So, good evening, everyone. It's an absolute pleasure to be here today, and I'm thrilled to guide you through an exciting conversation about the diverse career path in healthcare beyond the traditional research focused role. My name is Ruchi Babra. I spent around 2 years in Ernst and Young, and I have around 3.5 years of professional experience. So I have been working at the crossroads of healthcare and technology. My path began as a microbiologist and led me to a consultant in the healthcare space, including my experience in A&Y, which is a consulting firm. This experience allowed me to explore the challenges and opportunities in the healthcare sector. So I have a vision to digitize and transform the healthcare sector through technology. It's a journey about improving the healthcare outcomes for the patient, improving the access, and ensuring sustainability for the future. So I'm going to take you through my journey that how did I turn from a microbiologist into a consultant. So when I was in school, I had a very narrow view of the career paths available to the students who were taking medical at that time. I believed that medicine was the only option available. But as I experienced broader field of life sciences, I realized there was much more of it, and I decided to dive into microbiology. But something didn't quite click for me. I felt like I was searching for more, a deeper connection between my interests. I've always had a strong curiosity about technology, and I found myself dreaming of ways to bring my two passions together. That was health and technology. So there was a time in my second year when one of my professors invited me to a team working on a project. So they were working on this particular project where they wanted to build a software. So basically, they were training this model, by AI, so that whenever a researcher is trying to find a new species, they can know that whether this species has been found before or is this a new strain. So that would help a microbiologist to basically, further file it and patent it on their name. So I was working on that. So basically, one second, right? Yeah. So, although the project didn't go far as we hoped, it gave me an incredible insight. Health and technology could work together to solve real life problems. And this revolution, it was eye opening to me. And that's how I explored MBA, that was in healthcare IT. So, I was also actively volunteering during this time. I was the treasurer of my college. And that's how I started to understand that I wanted a career that would allow me to combine my leadership skills with my passion for health and technology. That's when I learned about the MBA in healthcare IT. And at that point of time in 2019, this program was offered by only a few institutions. So I was really skeptical whether I should move forward with it or should I move with the, you know, this moving on with MSc and then doing a PhD. But somehow I was not the person, who wants to be at the, be in a lab and search for different innovations. I was a person who wanted to communicate to the world about how healthcare has been transformed. So, yes, so at that point of time, I took a leap of faith. I was just as confused and unsure about what to do about, after my graduation, as many of you might feel today. The future seemed uncertain, but the decision of having, having this, has having consulting as an option was a turning point. It shaped my career in ways that aligned with my interest and passion, and ultimately led to the position that I am in right now. Yes. So as I reflect on my journey, I would like to share, my experience with you so that it might help you in your own journey. It might help you to take, any kind of decision making that maybe you are confused at this point of time, whether you want to continue with MSc, whether you want to do MBA or any other field. So I will share my experience as a healthcare consultant that might help you in your career. So I will start with giving you a snapshot of the Indian healthcare landscape. Indian healthcare sector is expanding rapidly, fueled by a growing population and the increasing need of care. But with over 1.4 billion people, the challenge is clear. How do we provide quality care to such a vast and diverse population? That remains a challenge. So recently I was working in AIMS and the patient to doctor ratio is, there are a lot of patients that are coming in for the best treatment in AIMS, but there are limited doctors. So here the the answer lies or the solution lies in innovation and digital healthcare. We are seeing new models of care emerge right from telemedicine. So during COVID, we got to know the importance of how telemedicine is really important because there are times when you cannot go to a doctor in the physical sense. So telemedicine became really important from that point of time. And there are various other digital health platforms. So you might not be aware, the government of India is working immensely on digitizing healthcare in India. There are various flagship programs like Ayushman Bharat. So through Ayushman Bharat, what we are trying to do is we are trying to create an ecosystem. So in this ecosystem, every player will interact with each other. What I mean, with player is doctors can interact with the patients, and doctors can simultaneously interact with the insurance providers, and all of them can be over. These operations can be overseen by government in order to see if there is any policy level change required. So the government is right now focusing on creating infrastructure, policy reforms, and affordable healthcare through PMJ, that is Pradhan Mantri Jan Arogya Yojana. So I am really happy to share that the government has extended this policy to 70 plus years, of 70 plus years of citizens, so that everyone can have the access and affordability to to have treatment accessible to them. So it is not only game changer, but there is a long road ahead. So now I'm going to take you through the focus areas. So from hospital services and medical tourism to the rapidly advancing medtech sector, we are witnessing innovation at every level. Diagnostic services and telemedicine are enabling healthcare access even in remote areas, and the insurance sector is becoming more inclusive with digitized process. So government of India is trying to make it transparent. It is to avoid any kind of fraud that happens with the insurance companies and similarly with the patients. So there are many cases when the patient is not getting the claim. Basically मैंने treatment ले लिया फिर उसके बाद मुझे अपना claim processing नहीं मिला due to n number of reasons. So this is how sometimes the insurance denies claims. So in case everything will be transparent, there will be a committee that will supervise all these frauds that are happening in the insurance sector, and that will be very much beneficial for every player in the market. It will be beneficial for the healthcare provider, it will be beneficial for the insurance, and it will also be beneficial to the patient, of course. And yeah, so that's about what are the focus areas in India, and there are key opportunity segments where we can definitely make a career. That is, one of them is hospital services. We can be a hospital administrator. We can build our career in medical tourism, medtech sector, diagnostic services, telemedicine, and in insurance sector. Yeah, so the industry is moving towards digital health revolution. There is innovation in healthcare sector, and healthcare delivery and services are, of prime importance to the government nowadays. Now, we are going to, explore different career paths in healthcare beyond lab, beyond being a researcher. So, I am a healthcare consultant, and apart from healthcare consultant, there are various other roles that you can opt for after your BSc or after your completion of MSc, and any degree that you are, doing right now in the life science domain. So we can be a data analyst. So I will explain what exactly is a data analyst, and I'll go one by one and explain you so that you have an idea about, what are these roles and how can you align your career with them. So data analyst. So data analyst is an individual who analyzes a lot of data. So data is analyzed in order to make decisions related to your facility. Let's say I'm a hospital and I wanted to understand that how much medicine or how much consumables do I require to run, or maybe for reducing my operational cost. Then this data comes very handy, and it is the role of a data analyst to give you insights for the same. Similarly, data analyst is also a very crucial role in terms of public health. So whenever we are going to, whenever we take any kind of policy decisions, data is the evidence that we require in order to make any decision-making process. So that's where the data analyst role comes into play. Health informatics specialist, it is mostly into, a DNA, genomic. So anything related to data, anything related to gene, DNA, and whatever is there in the bioinformatics sector. So anyone who is interested in this can combine technology with your knowledge of bioinformatics, and then we can, align a career to become a health informatics specialist. Medical coder. So, for example, I am I am a hospital where I want to refer a patient to another facility. I am AIMS and I want to refer it to Safdarjung. So I need to send the medical information to them so that they can have an easy access of the patient information when the patient arrives there in the emergency situation. But since health data is a very sensitive data, it's the data security concerns are really high. So for that, we communicate the data in forms of codes. Let's say fever will have certain code, symptoms, observations, treatment, everything has a certain code. So we classify these codes as ICD codes, International Classification of Diseases codes, NOMAD codes. So a lot of codes. So a medical coder helps to code that information so that the information is interoperable, which means one system can talk to the other system that this patient has this medical history, and it can be decoded and the information security is maintained. That is the role of a medical coder. Now we talk about business analyst. So business analyst is the person who talks to the client. Client can be an hospital, client can be a lab, client can be a government organization. So they basically talk to them, and they help a consulting firm to understand what are the requirements of the client and how well when we can deliver that. So if we talk about, building a software, so business analyst role would be to understand from a hospital what do they want in a software. Every hospital is unique and they have different needs. That's why I'll come to it what exactly is HIS and EMR. But the software that is used in hospitals are known as hospital management information system. So business analyst का role होता है डॉक्टर से समझना कि उनको सॉफ्टवेयर में क्या चाहिए, because doctors are not very well trained in technology, right? And they require the software to be customized so that they can easily adopt. So here the role of business analyst comes into play. Implementation specialist is the person who will be implementing that solution in the facility. Whenever we go from paperless to a fully digitized hospital, into a fully digitized hospital, there are a lot of workflows that needs to be aligned. Because there is a certain protocol in which the system is working and the software should align to that. So here the implementation specialist comes into play. They basically do the implementation and also do hand holding for the doctors ताकि वो उसको adopt करें, use करें, and they can get the benefit, the most benefit out of that. And then we have medical claims auditor. जब भी कोई हम ट्रीटमेंट लेने के लिए जाते हैं and we have an insurance, there is a certain treatment that is that is discussed and given to you by the doctor. So medical claims auditor क्या करते हैं, वो ट्रीटमेंट को एनालाइज करके दे चेक वेदर दिस ट्रीटमेंट is making sense for the condition of the patient or not. That is the role of a medical claims auditor. Also, post submission of the claim, they also check all the details and then they process and basically finalize the claim and मतलब वो कैश का reimbursement करते हैं to the client or to the patient or to the hospital. So that is about the medical claims auditor. Health product manager, software. If there is an organization who is making a healthcare product, so healthcare product manager will take into account the adoption. What is the UI UX? UI UX means the look and feel of an application. So they take care of that and they also handle a team who is working under them. So that is the role of a health product manager. Digital transformation expert, uh, they are mainly responsible for transforming the workflows. So seamlessly transforming the workflows from paper to digital, that is the role of a digital transformation expert. Hospital administrator are those people who take care of the operations in the hospital. Basically, they are floor managers, they are taking care of the quality, they are quality heads. So basically all the HODs that take care of the administration part of the hospital are known as hospital administrators. In medtech innovation, there are a lot of researchers who are who are working on their innovation. So this medtech innovation strategist provide them consulting about how they can make their innovation novel and how they can patent it further. That is about the different career paths that we can have beyond the research. Yes. So now this brings you know now we are going to talk about who can be a healthcare consultant. So can I have if you have any doubts, you can just put it in the chat box and I'm happy to answer that.
Participants, if you have any doubts, you can ask ma'am right now. And let's make it an
Ma'am,
interactive session. Like, let's not keep it a one-way thing.
Yeah.
ma'am, I have a doubt. I have an idea. That can I can we make that a electronic EHR by just speaking? Is it a
Hmm.
good idea or bad idea? Just you
Okay.
have to
So you're
speak the
asking my
medicine name.
perspective about EHR, right?
Yes, ma'am.
Oh, see, so before when EHR was introduced, there was a lot of concern about their data security and privacy. But now, in last year, the government has launched DPDP Act. It is there to protect the data of the patient. So post that, a lot of hospitals have understood that there is no concern related to data security, and they have started adopting that. So yes, there was a concern that patients' data might get leaked to insurance or maybe some other other organizations that could take advantage of that. But now I think EHR is more promising in nature. And talking about its outcome, so we have seen a lot of hospitals being fully digitized and they're actually availing the benefits of the EHR. EHR could be beneficial
No,
to the
ma'am,
patients in a way. Yeah. Yes, yes.
they are just scanning the report which is made by the doctors. My idea
Hmm.
is to just speak a device that clip on name the name of the devices clip on which clip on the doctor's coat, and the doctor have to speak the medicine name. It's automatically save in a
Okay.
paper like chart
Got
by
it.
chart at the X sheet, and which is
That's
transferred to the.
yeah.
Yes, ma'am.
Yeah. So you are right. So I think you are mentioning about the feature where the doctor can just have the consultation with the patient and the information that he's speaking is continuously transformed into a digitized form or matter, right?
Yes, ma'am.
Yeah. So there you can go and search about in there is a software known as Cognitio. You can just search on internet. So I will also give you a lot of links in the chat, so you can go through them. So they are doing the same work as suggested by you. It's a very good observation that you have. So now there are a lot of firms that are working on this. They are trying that the doctor need not to write it on the laptop because they are not very familiar with that. and the cost of data entry operator only increases the, you know, basically cost for the hospital. So this software will become very handy in order to increase the adoption. So yes, you're very right. I'm going to put 2, 3 sources in the chat box. You can go through that. They're doing amazing work in speech to text conversion for the doctors. And they're doing it in different languages
Yeah,
also. It's not just in English or Hindi language, because India is a diverse country, so they're doing it in a lot of language. Yeah.
thank you, ma'am, so much to let me know.
Thank you, Arvind. Yeah. So I yes. So I think we can
Good
move
evening.
forward now. Yeah. Uh,
Ma'am, can I ask you like how to become a health inspector, being in this life science background, like what can be the steps for that?
Regarding health inspector, I need to connect with with somebody who is in this. So I'll let you know. Just give me some time. I can explore in my network. If somebody is in that field, I can surely let you know. So
Okay,
healthcare
ma'am.
inspector in like what sense? You can you please elaborate?
Ma'am, a government employee who looks after a particular areas, health
Okay.
charts. Like recently, the pandemic hit, so the person who is controlling everything of that particular locality, like how many people were infected,
Okay.
etc.
Got it. Got it. I understand. So, see, I am working with GPS sector only. So, I'm working with National Health Authority and Ministry of Health and Family Welfare. So, there we have program management unit. So, for example, as you said about having supervision about regarding a particular geography. So, we have leads that take care of the particular. For example, I'll take example of a program. Let's say ABDM. Health is a state matter, and we need different program management units for each state. So there are people designated who takes care of healthcare transformation. So I think you're talking in that sense only. So let me check with them. How can you enter into that domain? Because my friends who were in, you know, who did MBA in public health, they were eligible to, be a part of these healthcare organizations. So I think from there, from that pathway, you can enter there, into being a healthcare inspector. But in order to give you deep insight, I need to speak to some people, and then definitely I'll get back to you. I hope that answers your
Okay.
question. Okay,
Yes,
thank you
ma'am.
so much.
Thank you.
Ma'am, can you
Thank you.
ma'am, can you please repeat the names of the company which are doing in my field?
Yes, yes, I will come to that. So I will come to some of the organizations where you can, apply as a healthcare consultant, or, since Pratima has asked me that how can students from biotech background dive into this field. So Pratima, we have a lot of projects where health, biotech uh, expertise is required. For example, I'll give you an example. So I'm working with ICMR right now. So they have a project related to patent. So what they want to do is they want to, I would, they want to make the patenting process very seamless for all the innovators that are doing research, and they want to patent their medtech innovation. So there we have patent agents who check whether this particular innovation is novel or not. So if you have a background in biotechnology, you can definitely give exams on patent agent. From there you can get into this field. Secondly, there are my colleagues who are working on biotech projects. So we are trying to digitize everything, and we require domain specialists to be a part of our teams. For example, I'm from microbiology. So they, at that point of time, they needed somebody who can help them transform the microbiology module. So there my knowledge came into use. Similarly, you have to look for projects where they are requiring people from biotechnology background, and that's how you can come into consulting, basically healthcare consulting. And but the problem is they do not take people who are just BSc or MSc. They want people who have some sort of business administrator experience. That's why I decided to do MBA in health IT. So you can explore. There are different, there are three kinds of, I would say, MBAs. One is in health IT, one is in public health, and the other one is in hospital administration. So you can explore whatever, whatever attracts you the most. I would advise you to go into public health or health IT, because you have a background in biotech that will align the most with it. So yeah, that is about biotech background.
Thank you so much, ma'am. Ma'am, what were the other options other than public health?
Yeah, so there is, as I mentioned, this, let me go through the deck once again. Yeah. So here you can become a data analyst. You can also become health informatics specialist, medical coder, business analyst, implementation specialist, hospital administrator, digital transformation expert, health product manager. So there are a lot of things where you can contribute apart from just being a consultant. So consultant is somebody who does all the job. So I have been in a project where I was, working on this as a data analyst. I have also worked as an implementation specialist. But you can just, you can go into one domain and become the expert of that. So healthcare consultant is like someone who has broader knowledge. They do not have, in-depth knowledge of one particular domain. We know everything on a wider scale and we help the client to solve the problems. But in case you want to go into something deeper, let's say if you want to go into the insurance sector, you can be a medical claims auditor. If you want to go as a medical coder, you can, have certifications around medical coding, and then you can enter that domain. So I think that answers your question. Okay. Yeah. So I'm going to talk about the job responsibilities and skills. In order to become a healthcare consultant, for a medical coder, I will get back to you on this since I have not been into medical coding much. So I need to check that. Although I've worked on medical coding projects, but I am not sure how can you, apply as a medical coder. Just give me some time. I'll get back to you on that. Yeah. Okay. So now we are going to talk about who can become a healthcare consultant. So it's a very broad and dynamic field that that is transforming the way we think about and deliver healthcare. Consultants can come from various diverse backgrounds. They can come from medicine. A person who is a BDS or MBBS can also become a consultant. Persons from public health background, someone who has done their bachelor's in public health, or let's say microbiology, biotechnology, biomedical sciences, they can also come into consulting. And anybody from business administration, those who have done their BBA in hospital administration, they can come into consulting. And also people from technical backgrounds like IT or engineering. So I have a colleague, he is a BTech in biomedical engineering. So he is also working with us as a consultant. So you can, there is a diversity in terms of people who can join the consulting background. It solely depends upon the project. So we have a lot of projects where we require domain experts, and here your expertise can come into play. The professionals such as doctors, nurses, pharmacists, researchers, and healthcare administrators, along with relevant industry experience, can successfully transition into the healthcare consulting background. So if you're doing BSc, MSc in any field, you can combine your education with MBA, that is MBA in healthcare administration, public health, and masters in hospital administration, or you can have certifications in healthcare management or data analytics. That's how you can enter into the consulting background. Apart from that, you will be requiring strong communication skills, problem solving abilities, and the knowledge of the healthcare systems and regulations in order to become a healthcare consultant. Now, I'm going to talk about who will be your potential employers in case you want to enter into a healthcare consulting background. So your client could be a hospital. So we have worked with AIMS Delhi. So they were our client. We were doing digital transformation for them. So the entire system was on paper. So we helped them to become digitally transformed. And now you can there is a scan and share system where the patient can scan and they can stand in the queue rather than waiting in the line and waiting for their turn. So that's how we're trying to digitize the entire workflow in the hospital. Your potential employer could be a insurance company where you could be a medical coder, you can be a medical claims auditor, pharmaceutical and biotech firms. So they are also taking they're also combining their IT with IT with the domain expertise, and you can, also join them. There are government and public health agencies. For example, I am working with National Health Authority. So there they hire PMU, as discussed during the last query, that there you can be aligned with the government, you can be a government employee, and you can work on different healthcare projects where you will be taking care of a particular state on different health indicators. And you can help the government to design policy. As mentioned that, government is doing a lot of work in public health, so you can be a part of that and you can contribute to the nation's digital transformation. You can also join a lot of startups and digital health companies. So there are a lot of startups who are working on AI. So there is a startup with the name of you know um, there is a startup that basically works on AI, and they are trying to find the faster diagnostics for tuberculosis. So you can join these firms and you can contribute your current skill set, and you can do MBA and join these companies in order to contribute more. And there are medtech companies, of course. There you can work on medical devices and medical equipment. You can help them, in you can contribute there. Basically, you can contribute as a healthcare consultant. So now I'm going to talk about what are the job responsibilities of a healthcare consultant. First, we do analyze the business operations. We streamline processes within the hospitals and clinics by analyzing their workflows, resource use, and staff productivity in order to improve patient care and reduce delays. So I'm going to give you an example. I was doing this project in SMS Hospital Jaipur. So there, our role was, since government has to announce the budget in the next 2 months, so we were given this task of analyzing the processes that are happening there. So there are certain guidelines that National Medical Commission has published. On that particular guideline, the hospital needs to align with those. We need, so we were there to check whether the hospital was aligning on that. Are there any loopholes in terms of processes or workflows or infrastructure that the government can intervene and they can allot budget to that? So basically हम वहाँ पे हमने बहुत सारी consultations की. We talked to a lot of doctors. We understood कि उनका pain point क्या है. Whether the equipment is faulty, whether they do not have required man force, या फिर उनके पास इक्विपमेंट तो है बट इक्विपमेंट फॉल्टी है, या फिर उनके पास नर्सेज इतनी नहीं है जो कि सारे पेशेंट्स को केटर कर पाए. So we did this complete analysis and we presented this to government so that the hospital can be efficiently run with all the allocated budget. So that was about the point number 1. Point number 2 is financial operation, financial performance. We help organization manage costs, boost their revenue, and improve financial planning by optimizing billing system, reimbursement strategies, and budget management. So when we digitize the data, so as I mentioned that data analyst का job होता है कि बहुत सारे data से insights निकालना. So what we do is we analyze those data and we help hospitals to strategize in a way that they can lower down their the cost, and they can increase their revenue so that their hospitals can run efficiently, and their they can earn maximum profit out of the services they are providing. Then there is regulatory and compliance support. We as a consultant, we ensure that the facilities are complying with the legal and accreditation standards. So we have NABH accreditation. I think most of you might have visited hospitals and you might have seen the symbol of NABH. So NABH क्या करता है, किसी भी हॉस्पिटल को एक क्वालिटी एक्रेडिटेशन दे देता है कि ये हॉस्पिटल ये सारे वर्कफ्लोज या प्रोटोकॉल्स फॉलो करता है इन टर्म्स ऑफ क्वालिटी. उससे हमें श्योरिटी हो जाती है कि ये हॉस्पिटल में हमें अच्छा ट्रीटमेंट मिलेगा, क्वालिटी ट्रीटमेंट मिलेगा. So as a consultant, our role is to make them NABH compliant and to understand where they are lacking in order to, sometimes there are certain gaps that are restricting them to become compliant with these standards. So we help them out in order to become NABH and ABD compliant. The next is strategy and innovation. So basically, we guide strategic decisions such as adopting new technologies, expanding services, or entering new markets, helping the organization stay competitive and future ready. Yes, so now these are the demand for healthcare consultants in India is booming. Hospitals, health systems, insurance companies, and government health agencies are looking for professionals who can guide them through complexities of digital transformation. But it's just not big organizations that are hiring. There are startups and medtech companies who are seeking to, take help from these talents in order to innovate and bring new innovation to the market. So as I have put some, logos on the screen. So Narayana Hospital, Max, you might be aware of these big chains of hospitals, Fortis, Asian, Apollo. So they require people to help them strategize their hospital operations. And here your, knowledge can be handy, and you can see them as a potential employer for you. They are consulting firms. So I am working with ENY as a consultant, but there are other consulting firms as well. So mostly people from life sciences, they approach IQVIA because IQVIA is doing great work in public health. So you can explore IQVIA's work and you can understand where your biotechnology domain can align with them and how you can enter the organization. So there are MBBs, McKinsey and Company, Bain and Company, BCG. They all are also working on these healthcare projects. There are government and public health agencies, as I mentioned. So one of my client is ICMR. So we are working for them, as I mentioned before, on a Patent Mitra portal. So there is World Health Organization. Our organization is also working with Gavi. We are working with ministries, and we are also working with Gates Foundation, BMGF, in order to, you know, basically we are a developing nation, and we need a lot of innovation in order to, bring healthcare full sway. So we are all working with them in order to make healthcare accessible to all, even in remote areas. So now I'm going to talk about essential skills and networking strategies for healthcare consultants. So when I was in my college, I had nobody to go to in order to understand, different healthcare domains. Let's say I'm a healthcare consultant, so I can give you my insights about that. But for, let's say you want to be a medical coder, so anybody who is doing that particular work would be the apt person to talk to. Obviously, I'll try to connect you with them, but then it would be really great if you can have a direct conversation with them. You can have, just about all the roles that I mentioned in the previous slide by talking to those people, right? And now earlier we were not aware about the potential of LinkedIn, but now we can definitely reach out to them and talk to them, block their calendar, and definitely discuss on what kind of work that they are doing. So yes, so talking about the essential skill, we need to have healthcare industry knowledge, and we need to understand requirement gathering. Now I'll go, I'll talk about certain skills that are required in the consulting domain. One of them is requirement gathering. अब requirement gathering का simple सा मतलब ये होता है कि in the layman language that मैं एक सॉफ्टवेयर बना रही हूँ, मैं सॉफ्टवेयर किसी के लिए बना रही हूँ, अगर मैं उनकी रिक्वायरमेंट से अलाइन होकर सॉफ्टवेयर नहीं बनाऊंगी, so they won't adopt it. मतलब उनके हेल्थ केयर वर्कफ्लो से वो अलाइन होना चाहिए. So requirement gathering is very essential, and I can give you a lot of examples where due to lack of proper requirement gathering, there was this project that got cancelled. Of course, not with my organization, but I have read a lot of case studies where requirement gathering played a key role in making or breaking that project. So the hospital for whom that software was created, they did not adopt it. It took the contract back from that particular company, and there was a lot of loss and layoffs. So requirement gathering is very, very important, and that is an essential skill. Even if you want to become a data analyst, you want to become, a consultant or a business analyst, this skill is really very important. So I would request everybody to just, type it in, type requirement gathering as a skill set and understand, how essential it is. Now, going to project management skill. So you, as a consultant, our role is to deliver quality, and that is the quality needs to be delivered on, on deadlines. So we need to manage that also, because in consulting, time is money. We provide certain deadlines to the client that by this time we will be providing you with such deliverable. So management is really very important for a consultant, and there you should also have familiarity with healthcare IT systems like EHR, that are electronic health records, telehealth platforms, and emerging technologies like AI. So AI is everywhere nowadays. So पहले क्या होता था that we used to learn something in our graduation, post graduation, and that skill set that used to stay us with a long, for a long time. We can survive in a, work with that particular skill. As we talk about our parents, they had that particular skill and they were able to, do with that skill for their entire career life. But now the workspace are continuously evolving, and we need to learn different technologies as and when they come, so that we are not obsolete. We are relevant to the industry. So AI is one of them. So I am also trying to learn more how AI can contribute in the healthcare sector. I can give you one example. So there is so EHR क्या करता है? EHR किसी भी पेशेंट के हेल्थ केयर डेटा को स्टोर करता है. It is a way of storing patient's data in a longitudinal form. So whenever we type those data, so there AI, so there is AI integrated into the EHR that will give us prompts of the potential treatment, potential diagnosis. So उससे क्या होता है? It aids the doctor in order to make better decisions with terms of treatment and the diagnosis. मतलब जो काम हमें विदाउट AI 6 months लगते किसी भी कॉम्प्लेक्स डिजीज को डायग्नोस करने में, अब वो हम 1 महीने में कर सकते हैं. So we are saving time, we are saving life. Also, in terms of technical skills, we can have proficiency in data analytics tools like Power BI, Excel, SPSS. SPSS is really essential when it comes to public health and art. You need to have strong collaboration skills and client relationship skills that are very essential. So that is all about, I would say, skill sets. And now I'm going to take you through how you can network with other people. So you can, whenever you are in doubt whether I should go into this domain, you should try and do an internship in that particular sector. That will help you a lot. They do not, any organization who is welcoming interns, they do not require a lot of work experience or a lot of skill set. You can learn on the job. So there you can understand whether that is for you or not, right? So you can do internships. You can build a strong LinkedIn profile showcasing your academic achievements and skills, and you can connect with people on LinkedIn and help to understand what kind of I would say alignment can be done from your career to that particular field. Like I can help you and guide about the healthcare consulting. There will be people who can help you more on the medical coding line, and I have a lot of my friends that can help you in the hospital administration domain. You should always have a mentor who is establishing in a healthcare consulting firm or any firm that you are willing to go. They'll help you to do a smooth transition, and they can also help you understand what kind of skill set are pre-required before entering that particular domain. You should participate in a lot of competitions and case studies that will help you to broaden your your thinking and your problem solving ability. And definitely you can reach out to your alumni. There will be people who have gone from your course to healthcare consulting firms. They can offer you guidance. They can definitely offer you reference and industry know-how. So yeah. So now we are going to talk about some of, this is the last slide. So I'm going to take you through some of my projects so that you can understand कि healthcare consultant का exactly काम होता क्या है. So I will start by Patent Mitra. As mentioned, Patent Mitra एक platform develop किया है ICMR ने. Basically, innovators को help करने के लिए in order to streamline the patenting process. So मेरा वहाँ पे ये काम था कि मुझे adoption create करना था, awareness create करना था about IPR among startups, academic institutions and innovators. इंडिया में बाकी इंडिया में इतने इनोवेशन नहीं होते हैं because people are not very familiar about the entire patent process. They feel that it is a very tedious process and they do not feel like getting into it. But our role was to educate those innovators, motivate them to file their patents and increase patent filing in India. I was also educating stakeholders on the patenting process, providing support in drafting and filing patents, and also I developed dashboard for them. As I mentioned that Power BI is a tool जो कि काफी helpful रहेगा आपके लिए consulting firm में. Power BI is a tool which will help you to develop dashboards. Dashboards are there in order to drive insights out of the data. So वो एक ऐसा tool है जो कि आपको काफी handy होगा whenever you want to switch into a consulting background. You should definitely try and explore that. Second, मेरा एक्सपीरियंस है ऑन्कोलॉजी स्टैंडर्ड्स फॉर एनसीजी. सो वी डिड दिस प्रोजेक्ट फॉर नेशनल कैंसर ग्रेड. यहाँ पे हमने ऑन्कोलॉजी डोमेन को लेके हेल्थ केयर स्टैंडर्ड्स डेवलप किए थे. वी डेवलप्ड EHR solely more like an EMR, electronic medical record module on oncology domain. So there are a lot of specialties. तो हम एक बेसिक EMR बना के सारी specialities को we cannot cover all this because every specialty has their own need. आपको जो डेटा फील्ड चाहिए होंगे ऑन्कोलॉजी में, that will be very different from a dentist who will be requiring different data fields. So we helped the NCG in order to build that EMR, and it is successfully functioning in cancer network hospitals. And yeah, so we did as is assessment. हमने ये as is assessment का मतलब होता है हमें ये जानना कि फिलहाल सिस्टम की स्टेज पे है. टू बी का मतलब होता है कि इस सिस्टम को उस पर्टिकुलर आउटकम तक पहुंचने के लिए दैट वी आर इन्विजनिंग, उसके लिए क्या क्या स्टेप्स फॉलो करने पड़ेंगे. What are some of the steps that we need to follow in order to make that system aligned with our vision? So that was about the oncology one. There was an SIDS program. So अभी गवर्नमेंट में ऐसा कोई मैंडेट नहीं है कि आपको अपने हॉस्पिटल में सॉफ्टवेयर लगवाना ही है. गवर्नमेंट कैन नॉट मैंडेट ऑल दीज these policy level changes because hospital is a sensitive area. We cannot just pressurize anybody to provide care in a certain manner. For that, गवर्नमेंट ऑफ इंडिया ने APTM adoption कराने के लिए SIDS प्रोग्राम स्टार्ट किया था, जहाँ पे हम डिफरेंट पायलट सिटीज में जाके हम कन्विंस करते थे कि इसका बेनिफिट क्या है and you should adopt this in order to streamline healthcare in India. That was one of my projects, and these are two different projects. So आप लोगों में से किसी को भी आभा अकाउंट के बारे में कोई भी इंफॉर्मेशन है? Do you know anything about आभा अकाउंट? I think okay. So Aadhaar account is like a as we have Aadhaar card. Similarly, हमारे health account number है जो हम hospitals में utilize करते हैं in order to basically have a longitudinal history. So in that particular building that I was there. So I helped government of India in building that ABHA account so that we can just move from one hospital to another hospital. We need not to carry a lot of files. So that's how we did the digital transformation. Yeah. And I think I have pretty much covered everything. So if you have any doubts, you can just ask me and we are open for discussion. This is my LinkedIn account. In case you want to connect me over LinkedIn, you can just scan this and we can have a chat. Yeah. So that's about my session. Yeah, Prati. Yes, I'm done with the session for today.
Yes, so I think we can have a few minutes for the Q&A session.
Sure, sure.
And also, I actually have a really interesting information for the participants as well. So since Miss Ruchi ma'am already emphasized so much that how much AI is important in the healthcare sector, so I'll just share my screen for you all. All right, so I hope my screen is visible. So we actually launching a course which can really be like a soft launch for your career in the healthcare domain. So this is a really compact and powerful 5-day learning experience, and it's designed specifically for biology students, researchers, and professionals who are eager to explore the world of artificial intelligence. And this course also blends core theory, there's hands-on practice, research-driven insights, and a project-based finale, all empowering you all to learn, build, and deploy AI solutions confidently in biological and life science domains. So we'll be launching this course from 19th May to 23rd May. And I really think it would be important for anyone who wants to launch their careers in healthcare sectors. And I'll also paste the registration link for you all in the chat box. Yeah, so the registration link is in the chat box. and you can easily soft launch your career in the healthcare industry.
I would just like to add a closing note. So, thank you very much, Ruchi, for this wonderful conversation, and it was really insightful. Like initially, as we discussed, so it would really help our students to gain like an exposure to what really lies out there in the world, and how
Yeah,
not just PhD and research is a career for students. There are all these opportunities that we have never heard of. So,
right, right.
really grateful for your talk today. It has opened so many doors for everyone that has joined here. And like how you, on such a short notice, you showed up for this talk, that is really appreciable.
Thank you so much, Vineet. And I really, appreciate the effort that Biopractify is taking. So, when I was a student, I did not have a platform wherein I can just connect and understand about the diverse career option. But Vineet is doing a great job. So, kudos to that. And that's why I thought that I can also contribute to them, manner that I can. So, yeah, definitely, I really like being here, and thank you to all the participants for showing on Sunday evening. I know everybody has plans, but then you all turned up. It was a really good session for me. So yeah, thank you so much for today.
Yeah, thank you very much. And we like although a lot of participants weren't able to join, so we
Okay,
plan to like publish these recordings. So if that is okay
sure.
from your end, then like other
Yeah, yeah,
participants
you
can
can do
also
that.
gain access.
Definitely,
So really grateful for this talk and would love to stay connected going forward as well.
definitely, yeah, definitely. You can just let me know if you want to tailor my session to a particular topic. I can definitely do that. And
Wonderful. Thank you very much.
yeah, I can connect to all the participants who were talking to, who were asking about the medical coding. So you can just connect me over LinkedIn and I can help you out as much as I can. So yeah. And also I'm putting the speech to text software in the chat. You can just have a look at it. Thank you so much, Vinny. Thank you, everybody.
Thank you very much.
Thank you so much, ma'am.
Thank you. Thank you.